Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Our guest in studio is Dr. Jason Fowler, here with us to talk about psoriatic arthritis, or PSA. He has a number of publications in the fields of gout, purine metabolism, and Lyme disease. Been in private practice in New York City since 1982, serving as chief of the arthritis clinic at Mount Sinai West Hospital currently, and also on the staff of Beth Israel and Lenox Hills Hospitals. How are you doing today, Dr. Fowler?
Yes, I'm doing very well. Thank you for having me, Neal.
Thank you for joining us today. You are in an intense effort to raise awareness about a condition that arises from the skin condition known as psoriasis. Now, you are associated with Celgene Corporation, is that correct?
I'm speaking on behalf of Celgene Corporation today for an educational campaign to raise awareness for this condition, yes.
And this condition is known as psoriatic arthritis?
That is correct.
I've never heard of. I have heard of psoriasis, but never psoriatic arthritis.
All right, Neal. So about 30% of individuals with psoriasis have concomitant arthritis, joint pain, which may be a result of the psoriasis affecting their joints, and actually it doesn't only have to affect joints. It can affect some soft tissue areas as well. But the fact that people have aches and pains and have psoriasis, they may not be aware that the two are linked. And the initiative that I represent today is called BE COUNTED, and it is to raise awareness of this entity.
And you say there's about a 30% of these folks are sufferers?
30% of the people who have psoriasis do go on to develop arthritis. That's correct.
And is there a reason why this percentage of people, what is it about their psoriasis as opposed to everyone else's that causes this entity?
Well, that is an excellent question, and I don't think I have the answer to that, and maybe you can figure it out and win a Nobel Prize. But right now, we don't know the answer to that link as to why certain people with psoriasis do get arthritis and certain people do not. There's a lot of work being done on the genetics of psoriasis as we get more and more adept at doing genome analysis and figuring out what genes different people have. We can find more and more associations with diseases.
Have you yourself noted more of an occurrence in a different age group or gender or anything like that?
Yes. Well, in general, psoriasis is more common in northern populations. The gene HLA-B27 is a gene that is associated to a significant extent with psoriasis and has also been associated with other forms of arthritis that involve the spine, as well as susceptibility to some other diseases, intestinal diseases, eye inflammation. So we know about those genetic links. And at times we are aware of something called the Keebner phenomenon in psoriasis, and that same thing can happen in psoriatic arthritis, where the disease occurs in an area of previous injury. So if you injure your skin, you may have psoriasis develop there. If you injure your joint, you may have psoriatic arthritis appear in that joint.
Now, are we talking about bruises or actual breaking of the skin?
Yes.
Or any type of injury?
Any type of, that's correct.
Okay. If someone has psoriasis and they treat the psoriasis, is that something that psoriasis can go away, yeah?
The psoriasis can absolutely be treated. There are a number of treatments for psoriasis, and some of the treatments treat just the skin, and some of the treatments will treat skin as well as arthritis.
If you treat the skin and everything clears up, is there still the chance that you can develop this type of arthritis with nothing going on the skin surface?
That is true, and in fact, there is a small percentage of patients who develop arthritis, psoriatic arthritis, and it isn't until some time later that they develop the skin manifestations of psoriasis, so that we actually don't know until later on that they had psoriatic arthritis from the start, we didn't know that that was the cause of their arthritis.
Does it ever factor in how a specific wound is treated, how the damage to the skin is treated in the first place before the onset of psoriasis and long before maybe the onset of psoriatic arthritis? Does that ever factor in how it's treated, or if it's maybe treated
No,
incorrectly?
that's not a specific issue. We do know that, for instance, psoriasis is much more common or is associated with obesity. We also know that psoriatic arthritis, interestingly, tends to affect certain joints and parts of the body more than others.
Now, you say you're harnessing the power of social media and the PSA patient community as well, as in conjunction with Celgene and other advocates and experts. Do you have like a network of people that are giving lectures and talks and plugging into social media, say Facebook and Twitter and whatnot, sort of like an army of social media?
Well, right now our main initiative is to get the word out through programs like this and to have individuals go to our website, which is the main vehicle for our spreading the word. We want people to be the vehicle here by sharing the website and sharing the information with their coworkers, friends, family, physicians, etc., so that we can spread the word.
Right, and that website is
PSA, which stands for Psoriatic Arthritis. PSAcounts.com. And the initiative is called Be Counted.
Be Counted. Well, all right. Thank you, Dr. Jason Fowler. It's been great speaking with you today. You've been listening to Health Professional Radio. I'm your host, Neal Howard. Dr. Jason Fowler speaking with us today as Chief of the Arthritis Clinic at Mount Sinai West Hospital, also on the staff of Beth Israel and Lenox Hills Hospitals. Been in private practice in New York City since 1982. Hails from Beaver Falls, Pennsylvania. I'm a New Brighton boy myself, so we've got a little bit in common there, other than the fact that we're sitting here now getting the word out. It's been great having you here, and I'm hoping you'll come back and speak with us some more about PSA.
Absolutely, I'd be happy to.
Thank you.
Thank you, Neal.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.